And so today's case study, this lady just left, and she came to see me because she has severe constipation, and she has severe constipation, and she has a massive amount of bloating, so much so that even though she's in her 60s, she looks like she has a pregnancy going on, and I could see that. Okay, she didn't have to even lift up her shirt. I could see that. And so the problem though is that this has been going on for 2 years. They're giving her tons of medications like Linzess. Okay, Linzess is one of the more newer constipation meds. But aside from that, here's the kind of thing I see a lot. Because doctors don't necessarily test for anything, they just kind of sit before you and they go that route. They gave her not one, but 2 anxiety meds, right? And so every time I see that in practice, what it tells me as a doctor is that these doctors had no time or patience to actually listen to their patients sitting before them, and they just want to like get them out of their office and they just give them anti-anxiety and antidepressants. I see this more than you guys would even believe. And so in the mind of the doctor sitting there, there's arrogance, thinking that this lady is crazy. She's just going off. Let's just give her something to calm her nerves and be on my way. Another doctor gave her like 2 minutes of his time and said, take Miralax and call me in 6 weeks. This kind of thing happens so many times. It makes me nuts. This lady is not crazy. She's just not listened to, all right? So thankfully, she's going to get tested in my office tomorrow. But I just wanted to review that with you. And then the other thing, too, is that she is saying that she has restless legs, but during the day. And she's like, is that what it's called? Is it restless legs in the day? And the answer is, it's definitely a mineral deficiency, right? And remember, minerals are foods. Foods are fats, carbs, proteins, vitamins, minerals, okay, and enzymes. And so this is what I use in practice to help my patients get well, because that is what heals the body. So, you know, it's not going to be hard to fix this person because I know what to look for. And so like when the source of stress is known, okay, when the source of stress is known, the treatment becomes obvious. And so that's just how it is. I mean, the body just needs to be given what it needs. It needs to be nourished back, step out of the way, and let the body do its job, right? So I'm really excited for that. I know there are probably a lot of you watching who have severe constipation or know somebody who is, and this is directly a liver issue. And I've said this many times on my scopes, that liver it's the quarterback of the gut. The liver is the quarterback of the gut, and one of the main things that the liver manufactures is something called bile. Bile runs the bowel movements. Bile runs the bowel movements. So if you have thick bile, you're going to have constipation. If you have thin, watery bile, you're going to have diarrhea.